forthcoming. To discuss, we're joined by the head of the Division of Public Health Surveillance and Response at the National Institute for Communicable Diseases, Dr. Michell Groome. Doctor, thank you for being with us. Very simply, are we entering a fifth wave?
I think it's too early to say. I think we are seeing a resurgence in the number of COVID-19 cases in the past week. So if you compare week on week, we've seen more than double the number of cases in this past week compared to the previous week. And we're also seeing an increase in the percent testing positive compared to the previous week. So definitely there are an increase in the number of cases, but I think it's too early to say whether we're entering another resurgence. I think it's really important that we also do keep a watch on our other indicators, and we're really interested in the indicators of severe disease, such as our hospitalizations and deaths.
Yeah, and it sounds like hospitals are not reporting increased deaths or anything like that. So at the moment, we can say that decoupling that we've seen in the past is still there. It doesn't seem so fatal, the variants that are circulating. Can we say that?
Well, I think it is a little bit early. I think we're seeing small increases in hospitalizations in some of the provinces. I think as with the fourth wave, we started seeing the increases mainly in Gauteng, also some increases in KZN and the Western Cape. But I think too early to say. We know there's this bit of a lag between hospitalizations. So definitely important to keep a watch on this. But I think similar to what we saw in the fourth wave, I think we have high levels of underlying immunity in our population, as well as increased coverage from the vaccines. And so we would expect those to be able to protect against severe disease.
What about the subvariants BA4 and BA5 are apparently being tracked? So you're saying that the immunity that's in the population would deal with that. Delta has also been found in wastewater.
Yeah, so I think we have detected those new sublineages of Omicron, which is the BA.4 and BA.5, and they are increasing in proportions, especially in Gauteng, is seen increase in proportion of BA.4, and in KZN, the BA.5. So at this stage, we're not 100% sure how these differ from BA.2. There seems to be some sort of advantage in terms of these two sublineages taking over now from the BA.2, similar to the BA.2 taking over from BA.1. So a little bit early to say. We wouldn't really expect any increased severity, but I think that does have these new sublineages do have some mutations that we would need to just watch, and particularly we'd be concerned about any kind of evasion of our immune system. But I think too early to say at this stage.
Well, can we cling and be happy with the fact that there are only subvariants of Omicron being reported, not a whole new variant, a complete unknown?
Yeah, so I think at this stage we haven't detected, any completely new variants, but I think obviously we are keeping a watch for that. Our previous resurgences, were triggered by new variants, but I think we're in a different stage of the pandemic now, and at the moment, we really have only seen the development of these new sublineages. But I think as always we are keeping track, particularly of the genomic sequencing, and so would be able to report. But at this stage, really just BA.4 and 5 would seem to be driving these increasing case numbers.
Doctor, do we know now how long natural immunity lasts for, or the vaccine immunity? I'm thinking about people who are possibly toying with the idea of getting a booster, but maybe had COVID. And of course, we have all these vaccines that are about to expire as well.
Yeah, I think it's very difficult to say. I think especially in our population, we've got quite, we've got a lot of differences in terms of the immunity, and we've got a lot of hybrid immunity, which means, people have been infected both by natural infection and have the vaccine. So difficult to tease out those, especially since we know we're not testing all of the people with COVID, and so some people might not even be aware that they've had COVID in the past. But I think in the absence of not knowing how long this lasts, I think definitely people who are due for their booster should really use this opportunity to go and get their boost. And I think if we can just expand our immunity, we will be in good stead for any possible resurgences.
All right, thank you very much. Something that we're watching for you, Dr. Michell Groome from the National Institute of Communicable Diseases.